I would love to start with seeing if you could briefly introduce yourself and tell us a little bit about where you're from and what type of work you do.
Yeah, so my name is Tom Rabelink. I'm a professor of medicine in the Leiden University Medical Center in the Netherlands, and I work in transplantation and kidney disease. Uh, my research focuses on stem cell biology. On the one hand, to understand how regeneration of organs occurs, and I think that's important biology for a field like transplantation, and also exploring the possibility to use stem cell derived tissue for transplant purposes.
Could you tell me a little bit why vascularized kidney organoids are a pivotal step towards transplantable organs?
Yeah, so I think there's two reasons why this is important. One is so we know that livers can regenerate, but other organs that we transplant, such as the kidney or the pancreas, lack endogenous regenerative capacity. And the fact that you can rebuild these organs in a dish basically allows you to study the biology of regeneration, which could help in preserving organs. Now, for this, it's a very specific title, but vascularization is an important component to make this happen, basically, and I will give some examples of that. And the other reason is that once you're on the job and when you start to grow kidney organoids or beta cells, assembloids, you can also start to consider to transplant these actual products as a source for functional replacement. And for the kidney, this is early days, but there is interesting or enticing preclinical data that suggests that this could be actually applied. For some other organs like beta cell replacement, this is quite advanced and has reached clinical trial at this moment.
Wow. So, what has changed recently that has made transplantable organs feel more realistic than it did a few years ago?
Well, it's still a very, very complex process, but so there's a couple of breakthroughs in this field. One is, in fact, that you can reprogram cells to become stem cells again. So this is not a very recent invention, but it's a critical invention in biology. I think that every cell contains the information for everything, basically. And if you can unlock this information, you can reprogram these cells towards the embryonic stage, and then start. This is what happened in the years thereafter. Start to understand what makes cells become a kidney cell or heart cell or a beta cell or a liver cell, for example. And this is part of it is self-organization, which gave sort of the initial burst to the field. But then later on, people started to understand what factors drive this, and it becomes more a scalable and manufacturable process. And like I said, for some fields, like for beta cells, this has arrived at the clinics, and others are moving towards that.
Wow. So, if you could give me one key insight that you don't want delegates to miss during your plenary session, what would that be?
So I think the thing that you don't want to miss is to understand the fascinating biology that is behind regeneration. So there's a potential that we only start to begin to unlock that can regenerate tissues. It happens all the time as we sit here. All our cells are being renewed, but to control this process and deploy it basically in clinical medicine is a really a big thing, and particularly for a field of like transplantation, where we now meet shortage of organs, and yeah, we only so we need to add new layers of technology to that to improve that field.
So let's talk about the big picture. The organ shortage and the unmet need in kidney disease is a global problem. So
Yes.
why regenerative medicine, why is it becoming so central to transplantation? And how do organoids fit into a broader strategy like cell therapy, tissue engineering, and replacement organs?
And so the broader picture, maybe why cell therapy sort of really took off, is in a way not in the transplant field or the kidney field, but really because of the oncology field, where CAR T cells have been sort of implemented. So that's a cellular therapy that deploys basically T cells to kill your tumor cells, so usually a hematological tumor. And in that, so that's a fantastic therapy, and works in people that are resistant for multiple other chemotherapies. And this drove basically a lot of the development of cellular therapies in general. So how to regulate this, how to manufacture this in a GMP way, how to scale this. And I think that accelerated the sort of the clinical translation a lot. And then behind it, you can actually start to come with reprogramming, either through organoids or maybe even in vivo in some day in the organs themselves, using basically all this regulatory framework and all these GMP scaling that has been developed in an accelerated way in immuno-oncology.
Wow. So, how should clinicians interpret progress in the field without overestimating these timelines that you were so sensitive to remind me of earlier in our conversation?
Yeah, one also has to be realistic. It's not like these organoids are going to be a therapy there next year or even within the 5 years. So for some fields like beta cell therapy and maybe liver cell therapy, this is really, because you have one cellular product, it's an attainable goal for a complex organ like a kidney that has more than 25 different sorts of cells. So you have to control a very complex differentiation program. This is further away, but I think on its way, we will learn a lot about the biology that already probably could be deployed in a field like transplantation to facilitate regeneration, to facilitate repair. Every time you, for example, if you transplant a kidney, there is ischemia reperfusion injury. So the kidney, also the transplanted kidney, has to go through a repair phase, which sort of resembles in some aspects what we also see in these organoids.
Wow. So let's talk a little bit more about that scientific and translational advancement that you're speaking about. So, what are the most critical remaining scientific barriers to achieving clinically viable kidney tissues?
So I think there are two or three folds. So one is that you have to control the differentiation program. So what you don't want to end up is with what they call off-target differentiation. So you end up with cartilage, for example, so that the stem cells go a different differentiation route. And the other thing from a transplantation perspective is actually how to transplant them so that they engraft. So vascularization has been shown in many occasions already, but you also need to have connectivity of the tubular compartment. And that's, I will show some exciting data during this meeting, but that's also quite a difficult thing to obtain in a controlled and reproducible way. But proof of concepts of all these things are there, basically. So now it's a matter of controlling it and scaling it and using, basically, as I said before, all the lessons that we learned from immuno-oncology, how to make this GMP and how to control for the regulatory environment.
Yeah, so you mentioned GMP. So how important are manufacturing and GMP capabilities in turning organoid science into actual therapies?
Super, super important. Because if you don't take this into consideration from the very start, then you have to redo everything. So a classical example in the field of organoids is that people use matrigel, which contains some animal components to grow the cells or to have them differentiate, and it works fantastic. But like I said, it contains animal components, which means that the moment you start to make a product out of it, you have to redo everything. And then in a gel that doesn't contain any animal, then usually the protocol doesn't work anymore. So you have to do a lot of work again. So it's really important to begin with the end in mind and think through how you actually could translate this also at some stage into a manufacturable product.
Fantastic. What near-term applications are most realistic? Is it modeling, repair, augmentation, before we actually get to full organ replacement?
Yeah, so modeling that's there now, and there's many examples of kidney diseases, but also other diseases that you can model in organoids, both in adult stem cell as well as these reprogrammed organoids. And that helps drug discovery, and it teaches a lot about the biology of regeneration. Sorry, what was the second question? Then
repair or augmentation, are any of those?
Yeah, then I think that biology will guide us how to facilitate repair, which is always on the table in the transplant field with every organ that you transplant. So we will derive lessons from that. I think if you look at cellular therapies, so adding into the equation either kidney assembloids or beta cells that function is like functional replacement, we have a clear path to how this could be developed. To build a whole organ in the lab, I think that's a very far future. I don't see that happen very quickly.
I understand. So let's talk about the future, some future directions here. So you've already mentioned a few, but what does success look like in the next 5 to 10 years for renal regeneration?
I think one big advancement would be if from this biology we understand how the kidney repairs itself, and that biology is basically in these vascularized organoids present. Because as I said, if you transplant the kidney, for example, you always have acute kidney injury, and the kidney can repair itself, but it doesn't always do it completely right. So sometimes you have what you call failed repair, and that sets the stage for fibrosis. So it's very important to understand that biology, to control that biology, so that a transplanted organ, particularly the kidney, which is very sensitive to ischemic injury, has a good start, and you don't end up with fibrosis. So I think this is really an attainable goal that you can derive from this organoid modeling.
So what types of research submissions are you hoping to see at TTS 2026 in this space?
Yeah, so I hope that, I hope that, so there's a lot of technology development in the transplant field. I'm particularly fascinated about the ex vivo perfusion systems, which are, I think, a nice model to also start to integrate these regenerative medicine therapies. So I expect and hope to see some new data on the perfusion system, and then think how we could integrate regenerative medicine in that. I'm also very curious to see what bioengineering can bring to the table here, and I think transplantation, more than any field, allows is very suitable for this modeling of technology and regeneration.
And so why does this conversation matter globally, and why is TTS the best venue for this space of regenerative kidney science?
Well, transplantation is the gift of life. Being a nephrologist myself, kidney disease is really a big problem. So it is really important to innovate this space, make more kidney transplants available, make sure that we transplant them, that they function better. And yeah, globally, there's 800 million people with chronic kidney disease. So that's really a lot. So we really should try to optimize the possibilities here.
Awesome.
And a
So
meeting like TTS is a fantastic venue for scientists then to interact, share ideas, and sort of build on a future for this field.
wonderful. Could I get you to give a brief encouragement for abstract submissions in the space of regenerative medicine, organoids, and bioengineering in kidney transplantation?
Well, like I said, advancement in these complex fields can only be achieved through scientific interaction. So people need to meet each other, have to discuss with one another, like we were having this discussion, how this could work. And I think having an abstract is the ideal platform to do this. So you present your data, you discuss your data, and you enrich your data by interacting with colleagues. And only by sharing these ideas, one can make real advancement.
Fantastic. Is there anything else you want to add about either the field or Sydney and the meeting?
No, I'm really looking forward. And Sydney is a great place to have such a meeting. And I think let's go there.
Fantastic. Well, I'm looking forward to meeting you in Sydney, and I really do appreciate you taking the time to talk about your plenary session and all of the interesting work that you're doing in regenerative transplantation and organoid development for kidneys. And thank you.